Hello, future PTAs. Hope y'all are doing great. So today we will be talking about the autonomic nervous system. The autonomic nervous system, or the ANS, controls the heart and smooth muscle, so a lot of your organs and your blood vessels. It controls the respiratory organs, the digestion, the urinary and reproductive organs, and the vascular system. It is subdivided into two divisions. The sympathetic is your fight or flight, and the parasympathetic is your rest and digest. So the sympathetic helps you prepare for emergency situations, and the parasympathetic helps you reach homeostasis. Those are their main goals. With the sympathetic system, again, that's fight or flight, helps you prepare for emergencies. It will shift blood from areas that are less necessary, such as your digestive organs, your reproductive organs, your urinary organs, and towards those are more that are more necessary for an emergency situation, your heart, your skeletal muscles. It increases your heart rate and your contractile strength of the heart, and then causes a general vasoconstriction, like to the blood vessels that go to the skin and to the digestive organs and the urinary organs and reproductive. And so it causes a systemic increase in blood pressure because of the vast amount of vasoconstriction happening in order to deliver more blood to the heart and the skeletal system. It causes sweating and goosebumps on the skin. The vasoconstriction can cause the person to go pale. It promotes salivation and dilation of the pupils to see better, and it stimulates release of epinephrine, acetylcholine, and norepinephrine. So those are some of your neurotransmitters that are released that cause a lot of these changes in the body. With the parasympathetic system, this is what allows you to rest and digest. So this is your body's way of maintaining homeostasis. So it helps innervate the internal organs, but not the skin, the muscles, or the blood vessels. It helps with regulating digestion, reproduction, urinary function, heart rate, and bronchial diameter for breathing. It will actually constrict the pupils and help with focus, the ability to focus your eyes on something. It actually causes tear and saliva production. It will help decrease that heart rate and the contractile strength back to a resting rate. It stimulates the release of digestive enzymes to help you digest. And then it can produce an erection if that area is stimulated, and it can help with stimulating bowel motility, movement of the hairs in the intestines in order to create a bowel movement. The autonomic regulation, this is, of course, controlled by the autonomic nervous system, specifically by the thalamus, and this controls the limbic system. It helps you regulate emotions, control basic drives like your sex drive and your hunger, and then aid in memory. It actually connects your body's emotions with the responses. So this is why if you get nervous, you blush. If you or sweat, if you get scared, you turn pale. If you have any really strong emotions that your body can, maybe if you're really nervous, maybe your stomach hurts, something like that, then your body responds. The spinal cord injury above a level of T4 actually disconnects the autonomic nervous system from the hypothalamus. So that's the control center. And so it causes issues with regulating body functions, which we talked about in the spinal cord injury lecture about autonomic dysreflexia. One of the reasons that can happen is because the thalamus and the autonomic nervous system are no longer connected, and they aren't speaking to each other, and so it's hard for your body to regulate all those functions like heart rate, respiratory rate, blood pressure, things like that. All right, so that was a really short lecture on the autonomic nervous system. I hope you learned something, and I will see you in the next lecture.